Madam Chair, Commissioner Reinhardt is in, and so I will spotlight Commissioner Reinhardt now. Okay, we are ready.
Roll.
I'm sorry, Madam Chair, there was a slight glitch in the audio in the chambers. Can you repeat what you just said? Thank you.
I sure can. The Ramsey County Board of Commissioners meeting is now called to order. I'd ask the clerk to please call the roll.
Thank you. Fredum,
Here.
Maris Castillo,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
Reinhardt,
Here.
and Carter.
Here. Thank you very much. Commissioner Reinhardt, would you please lead us in the Pledge of Allegiance?
Okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you very, very much, Commissioner Reinhardt. Board members, the agenda for December 14th is here. For your approval, is there a motion?
So moved, Madam Chair. Second.
Thank you, Commissioner, for the motion and the second. Is there any discussion on the agenda? If not, please call the roll. Thank you, our clerk.
Reinhardt,
Aye.
Fredum,
Aye.
Maris Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye. Thank you very much. The agenda is approved. And now your minutes from November 23rd are presented for your approval. Is there a motion in the second tier?
Move
So
approval.
moved. Second.
Thank you very much, Commissioners McDonough and Reinhardt. Is there any comment on the minutes from November 23rd? Thank you. If not, will our clerk please call the roll?
Reinhardt,
Aye.
Fredum,
Aye.
Maris Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye. And thank you very, very much. The minutes are approved. We are on to a portion in our meeting, which is quite a joyful occasion. And I'm going to be calling first on Commissioner McDonough, then for recognition of an employee award for Megan Coral. Commissioner McDonough.
Thank you, Madam Chair. Megan, welcome. I think I seen you were on the call, right?
Yes, thank you.
Yeah, good morning. Sorry we can't do this in person, but it doesn't take away from how strongly we feel for the work that you do and so many in this county do, and this opportunity to recognize you at this moment. Your colleagues have nominated you for this award, and it's my honor to be able to read off the proclamation, and I know they'll be getting you an actual plaque and an award here in the future, but it's my honor and pleasure to be able to read off your nomination summary. Megan Coral is a health educator with communications and public relations. She was nominated for a Ramsey County Employee Achievement Award in the category of Excellence of Job Performance. Megan is a strong innovator, always busy solving problems and looking for new solutions. Even though her job description does not mention a leadership role, she has helped and guided fellow coworkers and leads them indirectly. She takes the lead on public health web pages, coordinating design for service team, utilizing the Go Delivery email system, and managing the SharePoint infrastructure. Megan has been essential to the success of numerous responses to a range of public health emergencies and incidences by the county over the last 2 decades. She has helped draft communications surrounding Ebola, lead poisoning, H1N1, and of course, COVID, and many public health issues. Throughout the COVID-19 pandemic, Megan has successfully coordinated a vast amount of health education information on the basis of COVID-19, as well as testing and vaccination operations. Her colleagues describe her as having a genuine willingness to help consistently take charge when asked to do extra duties, as well as always having a positive outlook and a talent for friendliness that has a positive effect on everybody in her department. Megan is the embodiment of the county's residents' first focus, working every day to make information and design of web pages, flyers, brochures, online and printed forms, signage, and newsletters more accessible and easier to understand. She is an invaluable member of the Communications and Public Relations Department, whose attitude and work is truly appreciated by public health and other departments she interacts with. In summary, the Achievement Award Selection Committee recommends that Megan Coral be awarded a Ramsey County Achievement Award in the category of Excellence in Job Performance. And just a couple of things here, Megan. I know right now, probably the number one thing on your mind is get vaccinated. And if you're not feeling well, get tested, right? But the special part about these awards, and I'm so appreciative the county board gets to recognize individual employees such as you, Megan, at the board, is these nominations come from your colleagues. They come from people who see and observe you work every single day and appreciate the value and what you bring to the team you are working with. So congratulations to that. We honor you today. And certainly feel free to say a few words. And I don't know, I didn't get some talking points, but is there a supervisor or somebody here that would like to say a few words too in recognition of Megan?
Chair Carter, Commissioner McDonough, Commissioners, I'm Chris Burns, Communications Manager, Health and Wellness, and Megan Coral Supervisor within Communications and Public Relations. Just a few words. It's no exaggeration to say that over the last 22 months, in one way or another, Megan Coral likely has had a hand in all of the county's COVID-19 health information. She's been indispensable in helping to craft accurate, fast, and actionable health information for our community. And while this nomination highlights Megan's exceptional performance in health emergencies, she's also brought the same attention and skill to countless communications projects she's worked on over the last 24 years at the county. Continuous quality improvement is part of her DNA. She's always striving to find large and small ways to improve the quality and effectiveness of our communications, from the design of the community health assessment, resources for family accessing WIC services, services at Clinic 555, SOS, SHIP, and many, many other programs and services. As mentioned, she's unfailingly positive, always willing to take the time to help staff, even when she already has a full plate of other projects. Today, with this award, you publicly recognize what all of us who've worked with Megan over the years know about her exceptional work and commitment to public service. Congratulations, Megan.
Good morning, everyone. Madam Chair, Commissioner McDonough, I'd also like to say a few words about Megan. Congratulations, Megan. It's so well deserved. I've interacted with Megan even prior to being the public health director, just in her communication style, her willingness to navigate community input and to make sure that that's always a part of what we do. And so I just so appreciate you, Megan. And on behalf of the department, just a big thank you for all the work that you've done to support the entire team in communicating really important information, as Commissioner McDonough mentioned, around COVID-19 and going above and beyond, each and every time. So just a great appreciation on behalf of the Public Health Department and the work that you've done for over 20 years, which is unbelievable to me. You look great. And we just want to continue to work with you. And you just, yeah, you could just see her smile, right? And I think the first time I met Megan, she's just a ray of light and just so kind. So I so appreciate you and just the work that you're doing on behalf of the department and with communication. So thank you for always being a partner, not only with staff, but with community. Congratulations.
Megan, go ahead and say a few words there if you'd like.
Yes, I'd like to. Thank you. Thank you, Sarah, Chris, and commissioners. To be recognized for an award during a pandemic, when I'm surrounded by all my employees, all the employees that have been doing this and going above and beyond for the last 21 months, is actually a big honor for me. I've always enjoyed working the public health emergencies, but COVID-19 has certainly been an unprecedented experience. I'm learning new ways to communicate every single day. I'm thankful for leadership, both in communications and public health, who have supported me along the way and trusted me to do this work. And I would not even be here talking with you guys today if it wasn't for my amazing coworkers over the years. They've become friends who have been by my side, teaching me, learning with me, and guiding my work to make everything I do look better. Thank you very much for this recognition.
Thank you very, very much, Megan. We have all so much appreciated all of your work throughout the years. And of course, the mark of an incredible leader is the recognition of the force of the team. We appreciate that you have been a part of an amazing team. And of course, this past couple of years, the team has shown its strength and effectiveness and care and commitment in more ways than we could ever have imagined. We appreciate your leadership, your work throughout all of the past couple of years, and of course, since way before then. I am looking to the screen. Commissioners all recognize the work that you have done and are all nodding and appreciative and congratulating you today. Most of all, just very hopeful that you will take from the award, if nothing more, encouragement to continue such excellent work into the future. We're thankful to be able to recognize you. Commissioner Modis Castillo has her hand up as well.
Thank you, Madam Chair. You know, as I was reading these award write-ups, I think there's one line in this award for Megan that really stands out to me, and I think it deserves really to be highlighted, is leadership isn't in your job description, but our biggest leaders, our greatest leaders in this organization are those who maybe don't have an official title, but are leading from the rank and file, from making sure their teams are on board. And so, Megan, I really want to highlight that work that you've done. It really, truly is what makes us a great county to be in and to work for, and for our community to be recognized. And so I just wanted to say congratulations and thanks for leading.
Once again, thank you so very, very much. And I appreciate Commissioner Modis Castillo, your having emphasized the important sentence within the context of overall leadership. I am going to call now on our next award presentation. I will be calling on Commissioner McGuire, recognizing Andrea Jamison. Commissioner McGuire, thank you.
Thank you, Madam Chair. It is my deep honor to follow that Employee Achievement Award with another one of an amazing employee that we have. We know that we have a lot of amazing employees in Ramsey County, and I just appreciate the people that nominate these amazing women for these great awards. And so I would like to, on behalf of the board, read this nomination summary and just thank Andrea for her amazing work on behalf of the county. So with that, I see Andrea's on the call, so I am going to read this nomination. Andrea Jamison is a paralegal in the Ramsey County Attorney's Office. She was nominated by John Kelly and Sam Clark for a Ramsey County Employee Achievement Award in the category of Excellent Job Performance. Andrea's performance, leadership, teamwork, and can-do attitude have impressed her coworkers from day one of her 2 years on the paralegal team. Rather than waiting to be told what to do, Andrea uses her creativity and problem-solving skills to bring new ideas to the table. Her colleagues also praised her problem-solving skills, saying she has a talent for figuring things out quickly without a lot of help. These skills allowed her to solve a communications problem between departments at a high-level meeting. Andrea's colleagues say her positive can-do attitude helps elevate the entire paralegal team. She has taken on a training role, and her leadership supports new members of the paralegal team. She wants everyone to be successful and shares information and the spotlight. Andrea's work is consistently well beyond expectations, and her timeliness is described as otherworldly. On top of everything she does for Ramsey County, Andrea is also a full-time law student. Her work quality already exceeds that of a typical new attorney, according to Kelly. On behalf of the Ramsey County Board of Commissioners and the Employee Achievement Award Selection Committee, I hereby congratulate you and present you with this well-deserved award. Thank you, Andrea, for your excellent job performance and willingness to go above and beyond to help your team succeed. We really appreciate that. So, and with that, just want to add my huge thanks and congratulations for winning this award. And I know that maybe Sam or John would like to say a few words if they're on the call.
I would. Thank you, Chair Carter, Commissioner McGuire. I'm going to be very brief because I want to, like any good lawyer, correct the record here. Melita Drexler is the one who nominated Andrea, so she'll say just a little bit about Andrea. All I can say is, you know, any good paralegal elevates the work of everyone around them, which isn't always true of any good attorney. And Andrea's the best. You could think, you know, she's been around the county for a couple of years, but you'd think she's been around for 30, 40 years. And so with that, all I can say is that excellence doesn't begin to capture what Andrea brings to our small but mighty team in the civil division. And if you don't mind, commissioners, I'd like to hand the mic to Melita.
Good morning, commissioners. Thank you for this opportunity to say a few words about Andrea. Andrea now has actually worked for us almost 3 years. She started in December 3 years ago. Andrea is an essential part of our practice, and she is one of the engines that keeps us moving along. I cannot tell you that how often I think of how blessed I am to have the opportunity to work with Andrea, and she's really one of the finest paralegals I've ever worked with. She was a critical part of the legal team that was involved in responding to the data breach in 2018. She helps the litigation team of Kim Parker, Bob Roach, and John Ristad effectively respond to lawsuits against the county. And she's helped me personally with launching our bankruptcy practice so that we are engaging with nearly all the bankruptcy cases in which parcels in Ramsey County are involved. So I'm just so thrilled that Andrea is receiving this recognition that she so richly deserves. And thank you for recognizing her work.
I know that we have had speakers, but we haven't had the main speaker. And I'm going to call on you, Andrea, for a few words with respect to this recognition. Thank you so much for being with us.
Well, thank you, everyone. I wish I had a more formal speech, I guess, but I can't thank you all enough for this recognition. It's an amazing honor. And I really want to appreciate the team that I work with in the civil division. Everyone is incredibly supportive, have been great teachers and mentors to me, especially as a law student. It's been really great to have attorneys like Melita, who have been able to really guide me and challenge me as I develop my legal skills, so to speak. And it's just been a really great experience with Ramsey County, and I appreciate the county, and I definitely am incredibly honored by this recognition. So thank you, everyone. I appreciate it.
Thank you so very much. Lots of hands are clapping. I'd like to just acknowledge that we know you're going to be a fantastic attorney. You've been fantastic in your work as a paralegal here with us and as a full-time student. That is pretty intense. So thank you so much for sharing with us your time, attention, and commitment, and all of your marvelous skills in helping to support our work during such an important time as this. We have a commissioner who would like to add some thoughts. I'll call on Commissioner Fretham. Thank you, Commissioner.
I'll just jump in and say, from one full-time law student to another working a full-time job, I know how hard it is. Congrats. I hope you're done with finals, or that you'll get it done by, is it midnight tomorrow? And enjoy your winter break.
Thank you for those. Yes, and Andrea, it certainly is a sacrifice, I'm sure, for you to be here with us today. So thank you for sacrificing the time and for allowing us to recognize you here in public. Great appreciation.
Tony, you put yourself on mute.
Thanks. It's hard sometimes to want to leave this portion of our meeting. Again, congratulations to both our award winners, Megan Coral and Andrea Jameson, for the recognition that you have received today and for the work that you've done for all of us. And we will need to move on then to a very important part of our meeting. It is time for our COVID update. I'll call on our county manager for that update. County Manager O'Connor.
Thank you, Madam Chair. And we haven't been together for a few weeks. And so it's come during a time of increasing COVID case numbers as well. I'm going to turn to public health to start. I will then come back and give an update on vaccine testing in the county. I'll share an update on homelessness respite in particular, as well as ARPA, American Rescue Plan Act financing numbers. So we'll do a pretty comprehensive look today. I'll make one other plug as I go to Director Holly. And I mentioned this last week to our senior management team as well. If you have not been on our COVID-19 dashboard in a while at ramseycounty.us, you should. It is a remarkable piece of work between public health and communications, pulling that together. It's one of those things that when you feel lost in where are we at in the numbers and what are we seeing, it's a really good grounding. And so for anyone watching or for any of you, I found myself like needing to look at what do our local numbers again look like recently, and I hadn't been on our dashboard in a few weeks after being there every day for like a year. And going back, it was really just continued progress, service delivery updates. How is the county responding? A really good source to go to. With that, I'll turn it over to Director Holly to get us rolling.
Thank you, County Manager O'Connor. Madam Chair, Commissioners, it's great to be back here with you this Tuesday morning. It's been a while, it's been a few weeks, but a lot has changed since we last provided our COVID update. With the Delta variant continuing to be of great concern to all of us, and with the state's first COVID-19 case involving Omicron in Hennepin County, and with a resident, this occurred on December 2nd. In this instance, the individual was vaccinated but had mild symptoms which have been resolved. So that's good news here this morning. While Omicron is classified by the World Health Organization as a variant of concern, scientists are still working to determine how it may compare with the predominant Delta variant in terms of transmissibility and disease severity. Scientists are also studying the degree to which existing vaccines and therapies protect against Omicron. While we are concerned about Omicron, the highly infectious Delta variant continues to be the dominant strain here in Minnesota and in Ramsey County, and frankly, across the nation. As of last week, the level of community transmission in Ramsey County continues to be high, with the 7-county metro area seeing the same trend, and with a high level of community transmission throughout the western, midwestern, and eastern part of the United States. And as County Manager O'Connor mentioned, taking a look at our vaccine dashboard is important, but also monitoring our CDC transmission or county level data is also important. And that's where you can see on a day-to-day basis, kind of nationally and countywide, where we're sitting as far as community transmission. I also want to note this morning that it's of great concern for me and the team that our hospital systems are severely stretched, even for general admissions and emergency care, with the CDC reporting 131 new hospital admissions here in Ramsey County alone. So just a lot of information out there to take in that we also want to continue to share here as our COVID update. Some good news, last week, the Food and Drug Administration amended the emergency use authorization for Pfizer vaccine, authorizing the use of a single booster dose for people 16 and 17 years old, at least 6 months after completion of a primary vaccination with Pfizer. My department is working to get the protocol finalized to provide these vaccines at our community sites. And we are hoping to start these boosters as early as this weekend. So fingers crossed for that. A great thing to continue to urge people to get boosters in that age range. A lot happening again statewide. The governor launched the Celebrate Safely Minnesota campaign. And this is with coordination on a big statewide push that aims to help Minnesotans stay safe over the holidays. And so I know here at our county board updates, we have talked a lot about gathering, right, with families and friends. And so the focus on this is making it easy for Minnesotans to get vaccines, to get their boosters, and to get COVID-19 tests before they gather for the holidays. So that is a big push for our governor's office. Governor Walz also announced the taking action to offer even more COVID-19 at-home rapid tests and booster shots to Minnesota families. So he's secured an additional 1 million over-the-counter at-home rapid tests for schools and childcare providers to distribute directly to Minnesota families. The test is an individual rapid antigen test, which we've talked a lot about tests here at our COVID updates. And Minnesota expects to receive all 1 million tests before the end of the year. So if you're listening, community, those tests should be available, towards the beginning of the year through schools and child care providers. We're getting a lot of questions about testing and making, testing accessible. So this is a great feat for the governor's office, and hopefully we can get these out to the families here in Minnesota and also in Ramsey County. Beginning December 6th, Minnesota started offering boosters at multiple state-run and state-hosted vaccine clinics, including those hosted at schools. So there's roughly 35 state school-based vaccine clinics that are focused on reaching our 5 to 11-year-olds that will begin or that have begun offering booster shots for parents and children that are receiving their first or second dose. So you can get your kiddos vaccinated. You can also receive your booster shot at many of the clinics throughout Ramsey County. And so we continue to integrate that service here in our community sites, offering those first and second dose vaccines, our boosters, and also offering vaccines to our kiddos 5+. I'll continue to urge us as a community to get vaccinated. It's so important. Minnesota kiddos age 5 and up can be vaccinated. And so we really want to encourage parents to seek out vaccines at their school sites, at their pediatric clinics. We know that vaccines are the best way to protect yourself and your loved ones this holiday season. So I really want to stress that. Get tested. Even if you're not experiencing any symptoms, test before holiday gatherings. Dr. Ogawa can talk a little bit about this later. I think it's something that we need to continue to do. So very important. Get boosted, right? Get your boosters. All adults 16 and older can get a booster when they are due. And so continue to look for sites to do that. And then just stay safe. Wear your mask when you're in public indoor settings. At holiday gatherings to keep, your grandma, your auntie, your cousins, everyone around you safe during the holiday season. So we all know what to do to protect ourselves and our loved ones this holiday season and beyond. Now we just need to really take action to do so. And together we cannot give up. I just ask community and our board to not give up. This is a really challenging time. I know people are tired of wearing masks, right? They're probably tired of talking about COVID, but we really have to stay aware and progressive in our thinking around not giving up. We'll continue to monitor as a department the level of community transmission very closely as we try to mitigate the impact of this new variant and Delta. Now I'd like to turn it over to Incident Commander Laura Anderson to review the COVID data more locally. Thank you.
Thank you, Director Holly, County Manager, Board. Glad to be here today. Mike Lindsay, could you briefly bring up the situation update that's been described already a few times this morning?
Laura, we're getting a little static from you.
Oh, one moment. Is this, let's see, is this any better?
Oh, that's perfect.
Okay, good. Mike, if you could go ahead and scroll down, we'll take a look at the numbers a little bit further down. Yeah, right there, that's perfect. You can clearly see this Delta wave that we've been working against this fall. Very high case rate, very similar to what we saw last year. Again, unfortunately, these cases are primarily seen in individuals who are not vaccinated. Scroll a little bit further down, Mike, if you would. This is data from the Centers for Disease Control. You can see very clearly where Ramsey County sits among the 7-county metro. Case rates around 472 per 100,000, far beyond what we would like to see in terms of being able to reduce our mitigation activity locally or frankly across the state. If you could scroll down a bit further, Mike.
Actually, Laura, before you leave this chart, while we're on that chart, I think this is a really important piece as we're following our own move forward. Where do we sit relative to returning to office spaces in new ways, our own policies? And you can see that planning was going on in earnest back in August. The orange line, the middle dashed line, is the definition of when we would issue a 14-day notice to employees to be able to then, if you were phase 1, begin the actual return to office. And so you can see we are nowhere near that right now, but this is having these on here is very helpful for those of us who are watching the broader macro movements of the county to understand that as we get closer to those lines, that's more of where the next phases of our change would then come into play. Thanks, Laura.
Mm-hmm. Yeah, thank you for that context. And looking a little bit further down, again, if we look at positivity rates, from individuals seeking testing at this time, we're above 10% and have been for several weeks. So concerning numbers. Please keep an eye on this, especially as we move through the holidays. Testing is a little tough right now, again, because we have been seeing sort of, erratic use of testing. And we know that with Thanksgiving and then, of course, Christmas on the horizon, these numbers are going to jump around a bit. Mike, if you could move on to the vaccine dashboard. And then if you would just go ahead and scroll down, actually, we're going to take a look at our local summary. I think that's useful for us. As a whole, Ramsey County sits with 76% of individuals who are eligible having received at least one dose. That's among a 5+ population. So 81% of those who are 12+ have gotten at least one dose of a vaccine. But those numbers are rising somewhat slowly. I think it's important for us to remind ourselves. I took a look and I was reminded by our planning chief a few days ago. The governor issued a press release looking at kiddos under 18 and lauding the result. 25% of children less than 18 had received their first dose. Here in Ramsey County, we're sitting at about 32% of individuals under 18 having received their first dose. So we're doing quite well. Despite having a somewhat slower uptake than I would like among 5 to 11-year-olds. So taking a look more closely at what our department is doing, we have ourselves given almost 65,000 doses since the beginning of this last December. In terms of pediatric doses at our major clinics, we've given a little bit more than 3,400 doses since those kiddos became eligible. And 1,800 doses of booster shots. And we will obviously see those numbers continue to increase as we integrate 16 and 17-year-olds in our clinic. I actually was able to check in with our vaccine site managers a little bit earlier, and they intend to start giving doses to 16 and 17-year-olds actually as soon as today. So that's some good news for all of us. Just a quick reminder of where we are providing vaccine. We're at Arlington Hills Community Center. We're at New Brighton Community Center, the Consulate of Mexico. We've been working with a number of school districts and Petuteca Education Center in Roseville, Oxford Community Center, Como Park Elementary, Parkview Center School. Those are just the clinics that we had this past week. And our intention is to give about 1,600 doses this coming week. So that's just a brief look at where we are in terms of our response. And then I will go ahead and mute myself and ask Dr. Ogawa to join us for a brief update.
Thank you, Incident Commander Anderson, Chair Carter, Commissioners. I did want to start off by just reminding individuals how we stay safe as we begin to gather for the holidays. First and foremost, getting vaccinated and getting your boosters is, again, one of the best ways we know how to protect ourselves and those around us. The vaccines offer us nearly 95% protection against ending up in the hospital and dying from COVID. And we know right now, also as mentioned earlier, that our hospitals are quite overwhelmed and that we want space for those who are still very ill and those who are sick from other reasons other than COVID. Second, right now, the recommendations are masking up indoors, especially if you're mixing families that aren't around each other regularly. You may be, joining cousins, aunts for short visits, grandma and grandpa. But regardless of your vaccination status, if you're going to be indoors and with others, masking up is really also the best way to reduce transmission. In addition, if you're going to be meeting with individuals who are potentially unvaccinated or immune compromised, keeping yourself quarantined or your family quarantined for a week before that meeting is going to happen is another way, because you're reducing your risk of being exposed elsewhere and thus passing the infection on as well. Also then testing right before, and for each test, it's going to be a little bit different, right? Because it depends on how long it takes to come back. But for a PCR test, it's usually nowadays about 2 days before you get the result back. And so doing a PCR test in time to get the result before you're going to meet with individuals. And then I'm glad Director Holly mentioned the at-home tests. The at-home tests, I'll share with you, were designed to be tested in twos, really, and separated by 24 to 48 hours. And so if you're going, that's why they're packaged in sets of 2, not to give you a bonus, but actually to use it in tandem. And so you want to test at day 5 of your sort of quarantine and then day 7, so that when you do those back to back, it increases the sensitivity and specificity of those antigen tests. Also, meeting outdoors. I love the snow, so I'm, all for getting a little fire going and meeting outside where the air is exchanged quickly, or at least opening doors or opening windows potentially a little bit to enhance fresh air in spaces. And then also avoiding crowded spaces. So it may mean spreading out visits with family and things like that, but really avoiding the huge gatherings where more people are exposed to each other. So I think those are really important things to keep in mind as we gather. We do all want to be seeing our family and friends, but we also recognize that the rate of infection right now is so high that everyone is at risk. And while vaccines are exceptionally effective at keeping us out of the hospital, we know that they're not 100% effective at keeping us from getting infected across the board. And so we really need to do the other mitigation, masking, washing our hands, avoiding crowds, in order to really reduce transmission overall. I would be remiss if I didn't talk a little bit about Omicron and also other things that have been in the news, especially even today. The newest antiviral being looked at by the FDA from Pfizer that is used to treat after an individual is infected. So Omicron, the reason that we're concerned is there's over 30 essentially genetic changes, mutations within the capsule. And so we worry that it will be able to evade our most recent vaccines. The reality is we're seeing some protection. Definitely. We're definitely seeing protection against severe disease still, which was the goal ultimately. And we are still seeing some protection against transmission. We just don't know what that level is yet. And so that's also why I recommend the masks, regardless of your vaccination status right now. We should be getting some data coming out soon on that. So hopefully when we meet next week or the week after, we'll have a little bit more information. The newer medication recently, and the data released by Pfizer on their Paxlovid, I practiced saying that so that it came out right, was just being reported actually today and in the last 24 to 48 hours. It was studied on adults only, so it is adults only. It was studied on individuals who were symptomatic and who took it within 3 days of being symptomatic, 3 to 5 days actually. When that population was given the medication, it's an oral medication, which is very helpful. The risk reduction of progressing to hospitalization and death was reduced almost, well, they're reporting 85 to 89%, which is really, reassuring. The other reason that this is reassuring is that because it's an antiviral, period, it will work against variants potentially quicker than, say, our vaccines will. Okay. I want to caution though, because the study was on about 700 individuals in total. And so it's a reasonable number. It's a good study, but it's not quite the millions of individuals who have been vaccinated in a safe and effective way. And so it's reassuring. It's good. It's a tool in our toolbox, so to speak. But I urge caution about just how broadly we can use it in the future. Those are the main things that I was going to be touching on today. And then I'll turn it back to Director Holly to finish up. And as usual, we'll all be available for questions.
Thank you, Dr. Ogawa. Madam Chair, Commissioners, I'll turn it back over to County Manager O'Connor. Thank you.
Thanks, Director Holly. So as I mentioned, Madam Chair, 3 final updates. One of the questions we've had as we've had the Delta wave is a question around homeless individuals and respite and what does that look like? And throughout this entire time, our housing stability departments work closely with public health. And this is one of those spots where we spent a lot of money for unused beds for a long time at Bethesda as a part of our respite approach. And that's tough to do when you're trying to plan. However, we continue to follow the public health guidance that said don't get rid of those beds. And we're grateful that we didn't. We have had 35 rooms available for COVID respite. And we have 32 rooms available for COVID respite. And at our peak, we hit 35 individuals as of last week. We are now down to 24 again. And so we're back within the range that we want to be in, but we really saw that wave occur that had not happened at all at any point during COVID. Most of the time, our daily census has fluctuated between 0 and 3 to give you a sense of what that has looked like. And part of as our system continues to adapt and change going forward in homelessness, as we approach the spring and beyond, and as Bethesda becomes a site that will not be a site that the county is operating out of after May, we will continue to have an approach to respite that we'll talk about as we move ahead. But we will ensure that we're following that public health guidance and ensuring that we continue to have those resources available. These recent demonstrations suggest the need to ensure that we're continuing to work closely with housing stability and public health because an outbreak could happen quickly. As Omicron looks like something that could be more transmissible, even if slightly less severe, would be maybe the hope. We have plans in place too around what would it look like in the case if we had to bring other shelters into a partnership due to a surge in cases. And so the plan goes beyond our capacity at Bethesda, and we'll have that with us here through the winter to get us through. As I pivot to vaccine and testing policy, I wanted to share a few updates when accounting for full-time and part-time employees. In Ramsey County, 91.5% of employees have certified vaccination status. So it left us with 8.5% that have not. At this point, when you put in all employees, temporary, seasonal, intermittent, the total percentage of employees then is 85.1%. So it's slightly lower. That's not a surprise. What I would say now is when you look at this, part of what you then see, all departments we've been working with now as human resources directly with department leaders. There are individuals who are out on approved leaves. Those individuals would count as individuals who may not have certified, but yet if they're out on an approved leave, they may not have even seen their email. And so the data still has some noise in it, and we're going through case by case. I can cite multiple instances I personally know of where that was like a part of like having to work through the information. Additionally, if you're intermittent or seasonal, again, like that's part of the noise in the data that exists there. And so what we have seen though is significant drops, hundreds of employees in this final push here to saying you need to be vaccinated before written reprimands hit your file have occurred. And that's greatly appreciated on behalf of the organization. Where we sit right now, we've had 32 exemption requests for religious or medical reasons. The majority of those approved exemptions then require the employee to be submitting to the weekly testing. So this is where the testing piece has definitely been important to the overall system. Of the employees, 75% of all of our employees, any status, who have attested or certified, 75% have certified as vaccinated. That number is up. So then there's about 10% that have said they are not undergoing testing. So about 1 in 10 employees have been undertaking the testing route, not the vaccination route. And I had a final piece. 206 tests were submitted between December 3rd and December 10th to give you a sense on some of the testing side. And 7 employees found they tested positive for COVID across different departments at that time. So this policy is working both at keeping employees safe and ensuring that unvaccinated individuals who have a much higher likelihood of potentially contracting and transmitting COVID to others are catching it before they're coming into the workplace. We do have a breakdown by department of exactly what we see in terms of shares. And so I will share that information as a follow-up to today's meeting with all of you, as opposed to doing a line-by-line reading, but it gives you a sense of what we're seeing across the organization. The written reprimands, that work is beginning to actually land with employees and being delivered per work with our labor partners as well as early as this week. We've been working very hard along that lines over the last week about how to do those reprimands as part of the graduated disciplinary steps as we continue to move forward into greater severity if an employee's not certifying under either circumstance. Finally, on ARPA investments, I'll leave this at a very high level. Excitingly, today's board meeting and then next week, you're going to be seeing some of those initial investment pieces signaled by the boards. First steps are starting to come back. Today, it's about workforce. Next week, violence prevention will be one where you'll see something similar as you move from authorize into action as the work continues to move forward. CFO Kutza and I have been working on taking the 5 tiers of investment and asking the question of what does it now look like across our 5 tiers? What is the overall picture to paint back to the board and the public? And how much money is tied up in those 5 tiers versus the $106 million that was authorized by the federal government? The shortest and easiest way to put it is from tiers 1 to 5, when you count the money that the board has authorized and said move forward with, $100 million, just under 99.5 million is the total across the 5 tiers. Now, that includes money like affordable housing money, some of which you do not have available until next year when our second disbursement of ARPA dollars comes. So it's authorized funding, not spent. And there's always that important piece to track both, but authorized is really what have we said the investments are moving toward. 99.5 million. Then the other question is, across the 5 tiers, where does the money break down? And this is the first time we've had this at a rough number. Here's what I'll tell you. I'm 4 million off in the current math. So before we send it to you, we're trying to like clean it all up, but it gives you a sense. I'll work from tier 1, emergency type responses, $12 million in tier 1. Tier 2 and 3 related to the budget and continuing to run an operation of service delivery beyond the organizational capacity that otherwise existed. Tier 2 and 3 together are $20 million. So 12 in 1, 20 million in tiers 2 and 3 as a combined number. Tier 4, which becomes big partnership opportunities, moving toward that transformational side, $25.5 million. And then tier 5 around transformative work with a focus on housing, $37 million. What you can hopefully see in that is that in the early conversations that the board laid out of saying, we want to put as much money as we can into transformational change. By my math, you're seeing 62 million of the total 106 in tiers 4 and 5 alone, with the remainder of the money being put into emergency responses, continuing to plug holes, working through the budget process. It's heartening to see that. If you add up the remaining things that we have not brought to the board, but are potentially still out there, we get to a quick number of about 110 million. And so we're over the 106 that was allocated. That's okay. Like any process, that's kind of how you start and right size and prioritize. But I hope that gives at a broad level a sense of what we're seeing. We'll continue to clean this up. We plan to share this with the board in the days ahead, as well as then get it up on our website so that people can see specifically what the investments were in tiers 1, 2, 3, 4, and 5 to date. But I hope that gives you some confidence that the choices you're making align with the priorities set in that first workshop, and to have allocated directionally 100 million of 106 by the end of this year, before all that money's even here, when the federal government said you don't have to do that until 2024. I view that as a huge success for the organization as we leave this year. And I appreciate the board's leadership in putting the money in that space. Thank you, Madam Chair. We stand for any questions on all of those COVID topics.
Thank you, Ryan, very much thank you to all for the substantial update. I have not been ignoring you, Commissioner Ortega, but trying to find the right spot. I will call on Commissioner Ortega for our first question. Thank you.
Thank you, Madam Chair. This is for Dr. Ogawa. The first question is, for those folks that have been vaccinated and got the Delta virus, are they, and because the latest virus is so contagious or transmits so easily, what are we looking at multiple effects with folks here as we move on forward? I know part of it is a guess because we got such small database, but these are some of the questions people ask me, and I can't answer them, so I like to give out good answers.
Chair Carter, Commissioner Ortega, if I understand correctly, what you're wondering is, someone's vaccinated, they still get infected, most likely Delta right now, because it's still more than 90% of our infections.
They've had Delta.
Yep. With Omicron, are they protected more or less potentially against Omicron? Is that sort of, yeah.
Yeah, and if they're not, then, and because it's easily transmittable, are we going to be seeing this multiple effect?
Yeah. So the short answer is it's true. We don't know yet. We do know that the vaccines plus being boosted raise both our antibody and our overall ability to neutralize all of the coronavirus variants, okay? But we don't know to what level each of those it rises to yet. So it will offer some protection against Omicron. Being infected, we've talked previously a little bit about natural immunity or infection-based immunity. So I like to refer to it as infection-based protection. We know, unfortunately, that infection-based immunity also wanes, like all immunity. And so we don't know yet how long having had an infection will protect an individual as well. Our biggest fear, and it is coming to fruition, is that with each variation, mutation, new variant that COVID creates or becomes, the risk of infectivity usually increases. So it makes it easier to pass from individual to individual, and it makes it harder for our bodies to recognize it because now it looks different to our immune system. So it's very possible, and this is also sort of when we were talking previously about recognizing that COVID is not going away and that there will be these potential surges with new variants, to be aware and try and get ahead of them with interventions. So.
Well, okay, thank you for that. And this kind of leads to my second question. So as we, the board, plan moving forward, we'll probably, just by what you, I mean, if I take last year's experience and I sort of overlay it moving forward, I'm probably looking at another 6 months. I mean, it'll be summer again. I mean, we need to sort of repeat what we did last year between January and May in terms of hunkering down on at all levels. Because the feeling now is the vaccination is a two-edged sword in many ways. A lot of people feel safe and liberated. I mean, it's just, it is much different than it was a year ago in that sense. I'm just trying to get a handle of as we move forward and plan that we'll probably need to hunker down, as I say, all over again.
It is, sorry, Chair Carter, Commissioner Ortega, it is still, with the rate in the community of the virus being passed, and the fact that we know that individuals who are vaccinated are still at risk to both get the infection and transmit the infection. However, very importantly, protected against going into the hospital and dying, which are very important. The transmission is still quite high in the community. And so, yeah, the recommendations right now are avoiding crowds, similar to what we've been doing all of this time, wearing masks, reducing overall transmission.
All right, thank you.
Thank you very, very much, Commissioner. I'm going to turn to Commissioner McGuire, who has her hand as well.
Yeah. Thank you, Madam Chair, and thanks to everyone. Thanks, County Manager O'Connor, for you and your whole team on the ARPA dollars and just on the diligence on helping our employees get vaccinated. And thanks to all our employees who are really following that protocol and getting the vaccine or getting tested, and just hope that continues so we get 100%. That we get 100% involvement with that. So thank you for that. Just a couple of questions and comments, and just again, thanks to you, Director Holly and Incident Commander Anderson, for all your work and all your team. I'm struck by the fact that the chart showed that other counties are doing are not doing as well as we are, and I'm appreciative of the method of the measures that our county is taking. That we are meeting remotely, that we're masking, that we're doing all the things that we're doing, and I think it shows, that does beg the question: what are these other counties thinking when they see these charts? And I'm wondering if they're not seeing those charts, because unfortunately, some of us are going to, I'm trying not to go to very many in-person meetings, but I am in some, and I am with some of those colleagues in other counties, and I want to bring that chart with me to show them how their counties are doing and not doing as well as ours. But one question that I do have, and I have a couple of them, but I'm really glad that there are clinics in the community that are that one can go to get vaccinated and I think tested. I just want to clarify. And are any of those walk-in clinics, or do you have to register online for those? I'm thinking of, like, just as an example, the New Brighton Clinic, and are those, and then the school clinics, the Betu Pecha clinic, are those just for students or people in the school district, or is that for all community members that can go to those community clinics? Could we just get just like a little clarification on how one accesses those community clinics?
Chair Carter, Commissioner McGuire, I would be happy to answer that question. So our clinics, including our school clinics, are open to all. The districts do promote them to community members. So anyone ages 5+ can attend those clinics, receive a booster, receive a pediatric vaccine. That's part of how we intend to support our community. We do require appointments. The reason being, we need to make sure we have enough vaccine available at every location. We don't want to find ourselves in a situation where we run out at the end of the night. Having said that, we always include a buffer for walk-ins, folks who decide last minute, they're bringing their child to get a vaccine and they themselves want to get a booster or start that initial series. We're not going to say no to them at the door. So we always do have an opportunity for walk-ins. It's just somewhat limited. If you are, impromptu deciding to get a booster or start your series this week, I know Mall of America has absolutely expanded their offerings and is actively promoting walk-ins at those sites. So that's where I would go to first. And if you can go ahead and make an appointment, we do have availability next week. So thank you for the question.
Thank you for that. And then is there testing involved in those, or is that those are just for vaccination? If we want to get tested, we would need to go to the, we just have a couple of sites for testing. Could you just verify where we can go for testing, not those clinics though, right?
Mm-hmm.
Yeah.
So currently testing is available through the state community sites as well as the at-home testing kits. We are engaged in a pilot project with MDH, which will allow us to actually distribute over-the-counter testing. Waiting on ETA for that, but we will be actually distributing some over-the-counter tests at vaccines in the new year, or at vaccine clinics in the new year. So thank you for that question.
Okay.
Yep.
Yeah. Thanks for that clarification. I just wanted to make sure that if people go there for tests, that they're not going to be able to get it at the vaccine clinics, but go there for the vaccine for sure. So thank you for that. My second to the last question is for Dr. Ogawa, and thank you so much, Dr. Ogawa, because I'm always asking about these big events because my family is trying to be really careful, but we're also in the midst of people are starting to meet again, people are having funerals again, people are doing all these things, and we're all like, wait a minute, we shouldn't be really meeting in these big groups. And I would say that some of us are actually even like I went to a couple of conferences, and while I'm trying not to go to in-person meetings, the only people, there's very few of us wearing masks. So you can pretty much pick out who's going to be wearing a mask at these. And I will say that I was at one prenatal to 3 conference where 100% of the attendees were wearing masks. I was so proud of them, but it's not often the case. So I see every time if I see a colleague from Ramsey County, we're all wearing masks. So can you just talk a little bit about the efficacy or the importance of even just a few of you wearing a mask in a meeting? And because we do hear that you're wearing masks for others. So if so many people are not wearing masks, but a few of you are, is that still helpful? And I'm going to still keep wearing masks because it makes me feel, safer. But I just am curious how you respond to that when we're in a gathering, and I have a funeral this Friday. We're trying to figure out whether we should take my 94-year-old mother there. And we're thinking not, but just if some of us are wearing masks, but not everyone.
Chair Carter, Commissioner McGuire, that's actually it's a really good reminder and a really good question about masking. So what we do know is that masking definitely protects others, as we talked about, because it reduces, if you are already positive, it reduces your spread. We do believe it also reduces and protects you on some level as well, was one of those pieces that we talked about early on. Admittedly, we got it wrong in the beginning. First, we said it was only protecting others, and then we recognized it was offering some protection for you as well. So it's important to remember that it is offering you and or your family members some protection as well. There was a fantastic study done that looked at, though, what happens to overall transmission in, say, a classroom, right? If everybody was wearing, or if half of the people were wearing them, or if 1/4, or if only a few. And the reality is, with each of those levels, the risk of transmission does go down overall. So even if 50% of the participants are wearing masks, that's helpful, more helpful to those wearing masks still. But the more the individuals wear, so if you get everyone wearing a mask in a gathering, the overall risk to everyone drops actually significantly lower. And in fact, has been shown, if everybody is wearing even what we would consider a standard surgical mask like I'm wearing, the protection is actually better than if an individual was in an N95. Okay, so that is why it remains public health's recommendations right now. The more masks we wear collectively, the better we all collectively do. But it still does help protect the individual.
Thank you so much for that reminder that it's still good to wear masks, as many of, as I think all of us on this call are still doing. And so I really appreciate that, that great clarification and reminder. So my last question, Madam Chair, is for, I think it might be for County Manager O'Connor, and it's just sort of a curiosity. As I was driving through my district, I noticed, and I'm not sure, but we did have a overflow facility in Roseville that a Presbyterian Homes had for overflow hospital patients if the hospitals were at capacity with COVID patients. Has that still there, or I thought I saw it gone? And this is, I know, a state question, but I was thinking that would be a good place for maybe sheltering some of our homeless if it was still there. But I'm not sure it's still there. But do you have any knowledge of that? And is the state not having any of their do they not have their overflow facilities in place anymore, or do you know anything about that?
Madam Chair, Commissioner McGuire, I cannot answer the part specifically about the state. What I will say, though, on the homeless front that I think is important to state, even if there was space, we don't have any resources available to fund the operation of said space. When the money from ARPA and the earlier CARES Act is what led to us being able to fund the current system. And today you heard that money, it would require us to move money out of the tiers as defined to be able to fund additional. And so this gets to the part of, we're going to spend this legislative session making that point abundantly clear and very loudly, particularly as we see the state announce a budget surplus. I cannot think of a more humane thing to do than ensure some of that surplus goes towards those who need a place to sleep every night while we build affordable housing. And the board's been very clear on that. So that part I want to say, Dr. Ogawa can wrap it with the state space.
I appreciate that. Thank you for that absolute reminder that the resources would be extensive to do that. So thank you. Thank you for that.
And Dr. Ogawa did have her hand.
Oh, sorry, Chair Carter. Yeah, I I actually am learning to raise my hand electronically. Chair Carter, Commissioner McGuire, thank you. So the alternate care sites that are available throughout the state are specifically for non-COVID patients. Right. And so our respite is actually specifically for COVID positive individuals to get to help release them from a congregate setting. And so the opportunities are sort of opposite each other too. And so, but things to take into consideration.
Yeah, thank you. Thank you for that. I know this was one of those, right? This was one of those respite areas that where non-COVID patients were going to be. I just didn't see it anymore, and I thought, oh, I hope I didn't know what the state's plans were for that. Okay, thank you.
Thank you, Commissioner McGuire, for those questions. And we've covered a lot this morning in our COVID update. Undoubtedly, we could have lots of other questions. I'm going to pause to direct this back to County Manager O'Connor for any wrap up. If there are additional questions, please raise your hand. We have a substantial agenda to move on to. County
Thanks,
Manager
Madam
O'Connor.
Chair. We don't have any other updates. With 2 weeks off, it was good to get to do a full update, particularly since next week's will be truncated with a very busy agenda at the end of the year as well. So thanks for allowing us the time today.
Again, with much appreciation, let's just take a few moments, a few seconds, if you will, to commit our thoughts to those who have suffered, some have died, to those who are still being impacted, to all of our workers, including healthcare professionals and public health professionals who continue this work in committed service to our community and to our knowledge that Ramsey County, because of the extensive work that is being done, is seeing an advance in our ability to work toward transition out of this COVID pandemic, but we are not there yet. A few seconds, please. Thank you for those moments to clear the air, certainly not our thoughts, but to focus our thoughts on all of the work that we are doing as we conquer pandemic and move beyond. We'll move to our administrative agenda. Now ask Commissioner Reinhardt to lead us in that. Thank you, Commissioner Reinhardt.
Thank you, Chair Carter. I would like to make a comment about the COVID update, but since I knew I was going to be doing this, I figured I could just point it in there too. As you know, I've had total knee replacement surgery, and I ended up in the emergency room a little less than 2 weeks ago at Regents, and the staff and everyone that is involved, I mean, it was quite the experience. And I have to tell you that if there had been a choice, I wouldn't have gone, clearly, but they're doing such great work, and it's I think so important that people understand just the amount of stress that folks are under all throughout the healthcare industry, and that they are heroes. And I think we all know that there's so many people that have stepped up in so many different respects. So I just wanted to say thank you. Okay, moving on to the administrative items. Excuse me. I would like to move the number 4, the grant award from the University of New York Institute of State and Local Governance Committee for Reducing Revocation Challenge. Number 5 is a grant award from Minnesota Housing Finance Agency for Homework Starts with Home. Number 6, amendment to the agreement with NextGen Healthcare Information Systems, LLC for electronic health record and related services. Number 7, repurchase of a tax forfeited property located at 90 Crocus Place, St. Paul, 55102. Number 8, repurchase of a tax forfeited property located at 2550 38th Avenue Northeast, number 111 in St. Anthony. Number 9, repurchase of a tax forfeited property located at 2690 Oxford Street North, number 252 in Roseville. Number 10, switching subjects here a little bit, the Minnesota Opioid State Subdivision Memorandum of Agreement and Multi-State Opioid Settlements. Number 11. Okay. Number 11, Housing Endowment Fund, Sibley Cove loan payoff of a housing endowment fund. Number 12, funding for workforce programs through the American Rescue Plan Act. Number 13, the civil penalty fine schedule for violations of Ramsey County ordinances. Number 14, appointment of Sarah Holly, Director, Public Health, as the Community Health Services Administrator and Agent of the St. Paul Ramsey County Community Health Board. And finally, number 15 is the cancellation of a board meeting in the first quarter of 2022.
Is there a second?
Thank you.
Second.
Thank you very much, Commissioner Reinhardt and Commissioner McGuire. There is a motion and a second on all items. Number 10, however, has been pulled. So on the remaining items, the motion and the second applies. Are there any questions or comments before we move on? If not, I'll ask the clerk to please call the roll.
Reinhardt,
Aye.
Fretham,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye. Thank you very much. We are going to come back and request a motion and a second on number 10. But before we do so, let me just point out the huge amounts of work that we are moving forward today in this agenda. They have not been pulled. We have talked substantially along the way this year about the efforts that you see reflected here. There is so much that applies to our vision for a vibrant community for all here in Ramsey County with the work that we are doing along the pathway toward transforming all of our systems so that they work better for all, and in partnership with our community and with other partners in government and nonprofits. This work stands out, and I would just encourage you to look at the agenda of policy and funding reflected in the titles that Commissioner Reinhardt just shared with us. And I am thankful for the work that is moving forward. You know, I'll mention the revocation work and the grants to reduce revocation, our Minnesota housing finance work focused on housing stability and ensuring that our youth and families and seniors are well. The work that we're moving forward for healthcare information systems to be sure that we're better able to address the needs of our community. There's workforce agendas moving forward here today, and certainly the additional housing stability work around ensuring the support of housing for our families. We have work that is moving forward in ordinance preparation so that we can do a better job in a public health department of providing for violations without extreme response and unless appropriate. And finally, of course, we are grateful that we are, as a health board, confirming our appointment of Sarah Holly, who we've seen before us as public health director. Thank you for the huge work. And certainly we have challenges, but multiple opportunity to address those challenges as you see in this agenda and all as we move toward the end of this year and into next. I want then to ask for a motion on number 10, which is the Minnesota Opioids State Subdivision Memorandum of Agreement and Multi-State Opioid Settlement. I know that our county manager is going to be addressing that, I believe, but I must admit I'm not sure that I remembered whether you wanted to do that in your address at the end regarding county connections. So I've pulled it so that we can simply mark this as we move forward. Is there a motion?
So moved, Madam Chair.
Second.
Thank you for the motion and the second. And this represents the huge work that is happening here across the nation and in Minnesota with government organizations coming together, having recognized the huge damage that opioids have done in our community and ensuring that funds are available to focus on those impacts and to address health and wellness in our community as we share in those funds together with Minnesota organizations, counties coming together to agree upon commitment to an opioid settlement. I'd ask the county manager if you'd like to make comments about that at this point, or if you'd like to reserve your comments for later.
Thank you, Madam Chair and members. I won't reserve anything for later. I'll keep it brief and invite Civil Division Director Sam Clark, if he's here, to share his perspective as well. I want to acknowledge the work that Sam and County Attorney Choi have put in specifically at the negotiating table as a part of working to reach the agreement that the board sees in front of it today. And so in many ways, if you have specific questions, I would encourage you to ask Sam. He knows more than I do. I think the highlights that stand out for me most importantly are that this is a partnership with large entities and smaller entities across the state and local governments needing to work together. And at the end of the day, we believe that this settlement is a good opportunity for Ramsey County. It's one of the largest shares of local funds relative to the total amount of money across the country. And that signifies the important role that social services and community health occurs at the county level in this state. I just will end on saying there is no amount of money that makes up for the scourge of opioids and what it has done across our community, and particularly in marginalized communities where this further impacted it. And so this feels like an important step, but what happens with the funding, how we live it, how we apply it through our vision and values as an organization, how we further racial equity and think about redressing harms. There's a lot of work left to do with the board going forward, and today is but the first step to allow much of that to happen. And obviously more conversations to come, but that was, I know, an important piece for the board as well in the build-up. Sam, do you want to add anything specific to the actual agreement in front of us that helps highlight pieces?
I'll add two things. Thanks, Ryan and Chair Carter, commissioners. I think the first thing I want to mention is that the total amount that will be coming to the county is still TBD. That's because of the settlement structure nationally is a sliding scale based on participation of local governments. So assuming every local government that can participate does participate, we will be getting a share of about $222 million that's going directly to local governments. That was a real sticking point for us and for AMC. I should also give a huge shout out to Julie Rang and her team at AMC in helping pull this past the finish line. So assuming it's the 222 mil, we have the second highest percentage of that, so to speak, behind Hennepin County, of all the local governments in the state. And then secondly, I would just say that the money, there's a long list, I have not memorized it, of things that the money can be used for, but they fall into three basic buckets, which are treatment, prevention, and then other things like, I don't know, marketing and advertising potentials. So with that, I'm happy to answer any questions at this point. It did take a lot of effort to get where we're at. So it's this is a reflection of a lot of work, a lot of people's work.
Thank you very much, County Manager O'Connor, and also to Sam for the work that you and the Attorney's Office have done, to County Attorney Choi as well. Thank you so much for all your efforts, and certainly to all our partners, which I should mention also includes cities and counties, and of course, our state as well. I see a hand up from Commissioner McGuire.
Thank you, Madam Chair. I'm just going to echo some of the thanks, but first of all, of course, thank you to Attorney Sam Clark and County Attorney John Choi for their and our attorneys for their participation in this. And as Sam mentioned, we're the involvement of AMC and Julie Ring and her team there, Jill Surmeyer. We heard a lot about this at our annual meeting last week at AMC. But just we're all a huge part of our Association of Minnesota Counties, and we support it. And this is one of the reasons is that the statewide effort of that association and Julie Ring really helped us, I think, get to this place. And as I said, with the help of all the other attorneys in the room, but it was it is something that we should be grateful for, even though as County Manager O'Connor says, there's no amount of money that can really take away the pain that these opioids have caused. But this is a settlement that our state should be proud of. And just thanks to everyone that had a part in that. And I'm just grateful for our participation in our huge association with our Association of Minnesota Counties, that we are all very involved in that. And it's just, this is just one example of why that involvement is really important. So just thanks to everyone who made that, who made this happen. And I'll just say that counties across the state are all working to pass these resolutions in their counties so that this can actually happen, that it has to be agreement with all of the counties in the state. So it's still a huge effort, but thanks. And it's a great moment, I think, for us to get to this point. So thank you.
Thank you, Commissioner McGuire, and for your leadership at the Association of Minnesota Counties. And without further question or any hands up at this point, we have the opportunity to move this forward here at Ramsey County. And I will ask our clerk to call for the vote.
Reinhardt,
Aye.
Brother,
Aye.
Matas Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
and Carter.
Aye, and thank you very much then. That motion on the opioid settlement has passed. And we are moving on, having accomplished our administrative agenda to county connections. County Manager, go ahead.
Thanks, Madam Chair. Just one connection today. I feel like most of it related to the COVID-19 update. Excited to announce that in January, Ramsey County is partnering with McAllister College students on a project related to our work around appropriate responses and what does the community hub part of that broader violence prevention strategy look like. The question that students are helping us answer, it's a cohort, a class. What does it look like to have a community response hub that allows responses to non-emergency calls to 911? As Ramsey County works in partnership with community members to develop appropriate responses, one option of which will be community members potentially being dispatched to calls or preventing the need for them in the first place. Teams will focus on researching existing models, developing implementation and training plans, and thinking through how we evaluate success of this model. We had a really good partnership last year with St. Olaf College during January. Here's another opportunity this year. I want to thank Director Tolsman for working directly with McAllister College through the process to evaluate a number of different options. And there were a series of projects students had interest in, and this is the one that rose to the top. Just wanted to call that out today. Thank you.
Thank you very much, and certainly great appreciation for the opportunity to utilize the creativity and talents of our student community in helping us to advance this work. Thank you for the county connections. I'll call on board members now then for our outside board and committee reports, beginning with Commissioner Fretham. Commissioner Fretham.
Thank you, Chair Carter. I just wanted to share, I got to participate in the Tamarack Nature Center Volunteer Appreciation event this past Sunday. This is my third time doing this event. It's one of my favorite things of the year. Great way to honor and thank all of the amazing volunteers that help make Tamarack Nature Center one of my favorite places in Ramsey County. And so thank you to the volunteers, and then a big shout out to Noelle Roden, who's the naturalist coordinator who pulled together the event. It was really fun. There were different activities and photo spots and hot beverages and more roasting. And it was just a beautiful day. Also want to wish a congratulations and best of luck to Melanie Harding, who was with Tamarack for a while and has now taken a position with a nonprofit, is leaving Ramsey County, but did such great work for us at Tamarack. And just remind folks that Tamarack is out there, it's year round, it's beautiful this time of year. And really excited that we recently heard from our Parks Department that staff have formed a partnership with St. Paul Public Schools where all of the early learning students in St. Paul Public Schools have an opportunity to come to Tamarack for an outdoor educational experience to really make sure that everyone in Ramsey County has access to this beautiful and amazing natural resource. So thank you.
Thank you very much, Commissioner Fretham. I'll move on then to Commissioner Matas Castillo.
Thank you, Madam Chair. A couple updates on the NACO side. We've been working on two different movements in the Veterans and Military Services Committee. One is the CVSO Act and getting support for additional funding to fund our CVSOs, our Veteran Services, and also an introduction of a bill called the Cost of War Act, which covers exposure to toxins of our service members and that was part of the resolution we passed last year at our annual conference through NACO, and that has been introduced in Congress and is moving along. Also, I had the opportunity to meet with Senator Klobuchar's staff yesterday on elections infrastructure funding as well. And as you know, Senator Klobuchar has been the lead champion on elections funding and resources reform and continues to be our champion. And they're doing some work on infrastructure there to make sure there's some funding available. So it's got popularity in the Senate, not so much in the House, but we need to get some bills passed on the congressional side. So just wanted to share that update. And then also had the opportunity to join Commissioner McGuire and our park staff and IGR team around the Metro Parks meeting and the governor's staff. It was a great meeting, really talking about, and I think Mark McCabe said it the best, that our parks are being loved to death. And the pandemic and ongoing response where people have moved outside, we know that parks are an extension of our living rooms and really, really need to make sure that we have space and accessible space in our parks. And so it's great to have that connected support across the Metro, advocating for additional resources from the governor's office. And then last, I just wanted to say congrats to everyone who has been working on the European Christmas market at Union Depot. I had the opportunity to go on Sunday. It is a very well attended event. It was very crowded. People were wearing masks, so that was great, but really a beautiful event. If you have the chance to get, I highly encourage you to go. It is expanded. It's about 3 times the size as it once was, with lots of vendors spread out across the top of the outdoor space at the Union Depot. So one more example of great work and partnerships and really fun events at one of our facilities. Thank you, Madam Chair.
Thank you very much, Commissioner Manis-Castillo. Commissioner McDonough.
Yep, thanks, Madam Chair. 3 quick updates. I've reported in the past. I represent Association of Minnesota Counties on 2 statewide groups, one in public health. It's a group that's been pulled together through SHAC to make recommendations on a process and guidelines for a pot of money the legislature approved last year for public health. A couple of key things in that legislation is it couldn't supplant existing funds and really needed to be transformational in nature. And so this group has been really pulled together to help draft up the foundation for that RFP. I'm pleased to report we had potentially our last meeting last week. It's taken a while. A couple of things, not surprising. As you can imagine, with 51 different public health departments in this state, and they're all in different spots, there's a lot of pressure to actually supplant or utilize funds for ongoing work that they're doing or to strengthen work they're doing. And we've been able to, it's taken some time, but we've been able to really position this to be transformational money and in nature. And then the other piece of this, and again, not surprising here, is led by a few of us here to really incorporate equity and recognize the disparities in public health. And COVID has really highlighted that. It's just a part of it, but there isn't a place in public health where you just do not see the disparities. We've all talked about, the zip code issue of where you're born can really help determine your public health. And I'm pleased to report that we've been able to incorporate some very strong equity language into this. The RFP should be coming out within the next month or 2, giving public health departments access to funds. Legislature, in a positive note, I think has really indicated that they will want to continue with this pot as long as they see that there's value and it's structured in a way that aligns with their original legislation. So my hope is that we've been able to do that. Real quick, I'm also on a state advisory. MnDOT's in the process of revising their 5-year plan. This work has gone actually a much smoother, especially when it comes to the equity work and, being on this board and honored and proud to do so, and the work we're doing and helping to continue to carry that equity message across the state. And as you can imagine, we sit in those conversations. There are people that really struggle to even say the word, right? And to be able to have some really forthright and honest conversations about how we start incorporating that not only into policy and budget. MnDOT has been fully on board with this, and I think it's really been driven by some of the actions at the federal level where priorities have been started to develop as far as infrastructure funding. So we're getting to a good place on that 5-year plan to make recommendations to the commissioner for final approval. And then Ryan talked a little bit about in his COVID update about homelessness and some of the things occurring and how we've been funding it through CARES and ARPA. And we're all aware that May really does become a point here that we've been focusing in on because we're funded well. And I want to make sure people understand, you know, when Commissioner McGuire talked about, you know, a potential for a place, the issue here is after May. Right now, we are meeting the needs in our community. In fact, we're downsizing and actually getting prepared for May in a responsible way to have, you know, utilize our funds in a way. But the capacity issue is amazing. I've been a part of this for such a long time, and almost every time at this time of year when we have cold weather, we're having conversations at 10 o'clock on Friday night because we're getting calls of families, we're getting calls of individuals, we know of encampments, and that just has not occurred this year because of the work that we've done over the years and the investments we've made through the continuum of care and Heading Home Ramsey. We've really tried to take on and bring this to the community for a community response that has been stronger than, much stronger than it has been in the past. So many have looked to the county and many times to the city of St. Paul to really take that. And we've done that, but we really need to transition to a much broader community response. Our steering committee has done a lot of work into trying to identify 4 priorities to move forward on. Familiar Faces is a program that was started well before COVID, but kind of was parked as we got through COVID. Is one of these programs that was similar and built off a rush. If you recall, where we focused in on the top 100 users of shelter. This goes much broader in helping focus ourselves on individuals that are in the system for a long time, and we haven't been able to make a change in them. One of the other priorities that the steering committee has recommended to the governing board, knowing that in May, Bethesda will no longer be available, and there's been some positives. We've recognized and seen the advantage of having a 24-hour facility where folks do not have to leave at 7 o'clock in the morning and start lining up at 6 o'clock at night. And to start the process of looking for a bridge for a 100-bed shelter facility for singles to help bridge as we make our investment in affordable housing. And of course, there was the announcement from the city and the county yesterday on this large investment between us, helping ensure that we actually do a better job of housing. That would be a priority, is to help do that bridge. Another bridge would be for the families. Provincial House again has demonstrated that we can do better with our families than church basements, which was our tool in the past for the most part, after our family service center filled up. So there again, that has been moving forward to the governing board as a priority again to continue to find ongoing funding to bridge here as we continue to build more affordable housing. And then the last item that they're moving forward is day service programming such as Listening House and Freedom House, and recognizing the need for services during the day when Catholic Charities does have, you know, over 200 people entering the streets every morning and lining up at every night. And so those are being voted on electronically by our governing board. One of the things in the reconstituted continuum of care was to ensure that we're more relevant and effective. And so we've implemented processes here to be able to be nimble and move forward. So we're doing electronic voting now to confirm and validate those recommendations. And the key part of that and the need to get that done is then we will be meeting with a number of our governing board members to start working around funding strategies for these 4 priorities that include more than just the county and the city. And the strategies we'll be looking at, as Ryan pointed out, opportunities at the state level with their ARPA funds, and also within the private sector or within the broader community at whole, so that we're not just looking to Ramsey and the city of St. Paul to fund these programs. and we know we don't have enough funds and it gets too difficult. So I'm really happy about this past year and the continuum of care and the evolution that we've done here with this reconstituted group here, and the ownership that the community has taken and accepted the responsibility that this is broader and bigger. And the steering committee has been quite effective here in helping support that. So a little bit longer report than I intended to give on this, but it's some really good work that I want to make sure that all of you are aware of here and the broader community is at large, because I want to recognize Keith Latimer and Leah and Maggie and their work over in our housing stability group and supporting this, but then also in the work that they're doing. They've really helped teed up and getting the information that the steering committee needs to help advance these priorities. So with that, Madam Chair, thank you for your patience in that longer report.
And thank you very much, Commissioner McDonough. I appreciate the work that has been done this past year as we've organized these priorities of the board, and that you have done working together with the collaborative. I do see a hand from Commissioner Matis Castillo on this point.
Yes.
So I'll check in with you before we move on.
Thank you so much, Madam Chair, and thank you, Commissioner McDonough, for that report. I just wanted to take a moment to thank you for your work on this. This is a really difficult area to work on because people's lives are at stake, and everyone has a different opinion on how we solve this super complicated problem. And it's slow moving and it's a slog, but really important. And so I just wanted to take a moment to really highlight it, because this is, it's a highly emotionally charged topic. With lots of people at stake and a lot of moving parts, and it's hard because there's a debate about, do we fund shelter or do we fund housing, and it has to be both, and it's a continuum and it's an off ramp, and you've done a really great job in leading it. And so I just wanted to just pause a moment to highlight it, because I know how difficult it is, and you've been consistent and you've been in it, and it's messy, and I just appreciate you so much. So just wanted to add that.
Thank you so much again for the report. And we move on then to Commissioner McGuire.
Thank you, Madam Chair, and I'm glad I'm next because I want to add my thanks to Commissioner McDonough for all of his work in this area. But I just want to say to everyone on this board, I am so proud to be a member of this board. The work that we're all doing on behalf of our county, but then we're of course partnering with our local communities, our state, and our federal government. It's just always gives me hope when I hear about all of the updates, about all the amazing work that we're all doing on all levels. And never apologize, Commissioner McDonough, for giving a good report like that. You can take as long as you want to talk about all that amazing work that you're doing, as far as I'm concerned. And so thank you for that. And Commissioner Matis Castillo for your national work on veterans. Your leadership in that is really appreciated. And as I'm going to give a bit of a legislative report, I'm going to thank Commissioner Reinhardt for her amazing work on behalf of our environment. And so this was brought to us. So I'm just going to say that we don't need to take action on this, but I just want to recognize that Ramsey County has been asked by an organization to sign on to a letter to our congressional delegation regarding advancing a clean fuel standard. This was brought to us by Commissioner Reinhardt, and we don't need to take action because it's already part of our platform that we support things like this. But I just want to say that I want to give you a little background on it. The clean fuel standard proposal in Minnesota advances our goals related to greenhouse gas reductions, clean fuel adoption, equity, and economic development. The letter asks our federal delegation to consider moving this work at the federal level. A clean fuel standard adopted at the state or federal level can help Minnesota and the nation get back on track in meeting our greenhouse gas reduction and clean fuel development goals. This is in alignment with our established policy goal of addressing climate change. The organizations listed on the letter represent a wide but not exclusive list of stakeholders deeply invested in reducing emissions from transportation fuels, including automakers, environmental groups, utilities, science-based organizations, renewable fuel producers, technology companies, electric vehicle organizations, renewable fuel producers, technology companies, electric vehicle charging companies, nonprofits, clean energy organizations, counties, and more. So we're joining a great group of people. The Great Plains Institute is organizing this effort. So I just want to thank Commissioner Reinhardt for bringing this forward, and we are going to sign on to that. Just wanted to let you all know that we're adding our voice to theirs. And just to let everyone know, while I'm giving the legislative update a little bit here, that our 2022 platform will be finalized and ready for us to vote on next week. So we'll be looking forward to that. And just thanks again to our committee, which continues to meet weekly, Commissioner Mattis Castillo, myself, Jenna Rourke, and Melissa Finnegan, and then our lobbyist team. So thanks to everyone for all of their work in this effort. So with that, Madam Chair, I'll just talk a little bit about some of the things that have been going on. We have had a few weeks in between our last board meeting, and we've all been doing a lot of work. I was fortunate to be part of a prenatal to 3 conference where I mentioned earlier that 100% of the people were wearing masks. I was excited about that. It's a NACO, or National Association of Counties, inaugural county leaders prenatal to 3 academy, and I was able to present at that some of the great work that we're doing that you're going to all hear about this afternoon in our workshop. And we were able to talk a bit about that group that's been going on that Commissioner Fretham has been involved in, and we're all very supportive of, and Commissioner Carter, of course, has been leading on as well. So that was a great thing to be a part of. And we had our large Urban County Caucus meeting and a board meeting where we had many great presentations about the things that we're all faced with, which include housing and homelessness. We had a great presentation on urban farming, and so and dealing with our the COVID pandemic. Also, AMC had their annual meeting that some of us were able to be a part of. It was a great meeting. We heard about the opioid settlement, which I've already referenced. The governor spoke. Our NACO president, Larry Johnson, came and also addressed the group. We approved our legislative agenda, and we elected a new second vice president. Neil Galswick was elected. I want to thank our current president, now past president, Rich Svay, who served for 2 years. We had voted to extend our terms because it was during the pandemic, and we wanted the stability of the board. And thanks to Rich for serving 2 years on the AMC as the AMC president. So that was a great conference, and I know we were recognized several. We recognized Kathy Hadeen for her excellent performance, and also our elections committee. But I know we're going to do a separate recognition of that at our board. The Ramsey County League of Local Government had their annual meeting last week. We heard from Arlene Chermeroff from the Federal Reserve and Alan Page. They talked about their education amendment, the constitutional amendment that they're promoting at the legislature, where all children are guaranteed a quality education. It seems like it should be one that not many people would oppose, but it is interesting how people are not all supportive of that. But it was a great meeting, and Ramsey County League of Local Government is continuing to do great work. Also, Active Living had their meeting yesterday, and we had a great presentation, and we are continuing our equity conversation series where we're hearing from those that are working on equity in our county, and we heard from the Equitable Urban Agriculture with the Twin Cities Community Agricultural Land Trust, or TCALT. And that was a great way that we're talking about how do we get more urban farming, community gardens, how do we really work with that within Ramsey County. And it was a great meeting, and at some point it would be great. We'll do a workshop, I think, on that, or I'll ask for a workshop. We also heard about our trail studies on Victoria Street, Lake Johanna Boulevard, and Vadnais Boulevard, and our complete streets training with Smart Growth America, which is a great grant that we got. So that was Active Living. I just want to say that the Parade of Optimism, our Optimist Club in the northern area, is doing another parade this Friday where we're going and they're singing in front, at senior locations, and they're going to be singing at Lake Owasso as well on Friday afternoon. So I'm really proud of the Optimist Club for organizing that. And I also went to the Christmas Kindles, or the Christmas Mart at the depot, and it was great. I went Saturday evening, and it was very crowded as well. So kudos to the depot and all their great work. Okay, with that, Madam Chair, that's, I'll end my report.
Thank you for a lively report in full,
Lots
Commissioner
going on.
McGuire.
It's been 3
Appreciate
weeks,
it.
Madam Chair,
Yes,
since
it
our
has.
last reporting.
And Commissioner Ortega.
Thank you, Madam Chair. I'll try and give a quick synopsis. I know we're a little behind schedule here. I think let's talk about the bonding tour because we had Commissioner Carter and Mata Castillo early in the morning, and myself, along with Representative Carlos Mariani, and we thank him for, he is the sponsor of our River's Edge bonding request. It was a good turnout. Everybody did a good job. That was very positive. Later that afternoon, I presented for the Riverview Corridor to the same bonding committee, but it was in the late afternoon, and Representative Dave Pinto was there alongside with me. So thank you to Representative Pinto. It's good to see that our legislative partners are really stepping up this year on our request. Then a few days later, I met with the Commissioner of Management and Budget to see if we get River's Edge into the governor's capital budget. That meeting was very good, very productive. We spoke for a half hour and presented. And then last but not least, there were other things in between, but was the tree lighting at the Union Depot 2 weekends ago. I got to tell you that while we had a great crowd, the European market outside was packed. The inside was not like other years. I mean, but when we lit the tree, not only you're facing the crowd, but when I look back, people must have come out who were worried about being indoors. It was completely packed from the light rail station to the depot. So behind me and in front of me, I was completely circled by folks in the community and people that came in from outside of St. Paul. That was the first time I've seen that in 10 years. So it was a great turnout, and people, I realized how important it was just to light up that tree, and the way the crowd were excited and cheerful. It was a different, and of course we had more people outside just packing it in. So that's my report, Madam Chair.
Thank you very much, Commissioner Ortega. To remind me how long it's been since we've been together. Commissioner Reinhardt.
Thank you, Madam Chair. Well, I can tell you, Commissioner Ortega, that my holiday card this year is on the Mississippi, and it was perfectly photographed by Darren Tobolt. And when we get, and hopefully not too many years from now, we're going to do that picture again, and River's Edge will be in the background. And so very exciting in moving forward with this. I also wanted to say thank you to Commissioner McDonough for the comments that he made earlier, and the recognizing the complexity of so many issues that we face, and that one size just doesn't fit all. Sometimes people want to oversimplify the things that have to be done, and there's money here and there's money there. Well, it's just not that simple. And I think Commissioner McDonough, not only is the work that you did great, but your explanation and trying to get people to at least get a flavor of the complexities of the issues that we are trying to undertake and figuring out the best way to deal with them. Even though, and I'm missing out on some of the really fun stuff like the tree lighting and all of that, because I'm homebound. I'm with the recovery from the knee surgery. I will say thank you to all the people that have reached out to me and been encouraging as I've gone forward. I've told the physical therapist, I said, I'm rounding corners. I just didn't realize how many corners there were going to be. So, but it's going well. It's just going to be slow. So that's the way it is. There's a couple of things. The Recycling and Energy Center board met. There's so much happening there. And again, progress that is being made on really making this the facility that we all wanted it to be, with many different options other than just landfilling the waste that we have, and trying to pull out many more recyclables. And that's an exciting project as well. A number of other meetings that I participated in, But the one thing that I really want to highlight is not a meeting, but a milestone. And that is the Purple Line milestone, the official entry in the project development phase of the Federal Transit Administration's Capital Investment Grants Program. We've been working towards this for quite some time, and that has taken place. At the same time that's happening, Andy Gitzloff, the lead person for Ramsey County Regional Rail for the Purple Line, has accepted a new job and new adventures. I guess, once he did this, how could he not try something even bigger, I guess. So we wish him well, but he will be missed. But the team that we have there is so incredible. And I know that Commissioner Ortega and others have worked with all of those members of the team, and they're very thoughtful, and sometimes it can get to be a pretty heated discussion, but we're trying to get out the best information that we can, the facts. And when people want to hear the facts, they will. If they don't, they won't. So we just keep plugging away on that as well. But I just wanted to note that it is a huge milestone, and that transition to the Metropolitan Council is nearly complete with that milestone. Thank you, Madam Chair.
Once again, thank you so much for these vibrant reports. I know that so much has been shared, for which we're grateful and appreciative, and I won't go back over the things that were already shared, except to say congratulations to our staff, to Deputy County Manager Kathy Hadeen, and also to our voting and census work that has been done for the awards that were recognized at the Association of Minnesota Counties. I just want to share a few things then. First of all, to have been present along with Commissioner Maris Castillo in announcing our funding for deeply affordable housing. Thank you so very much to all of you on the Ramsey County Board for all of the collaborative work that has been lifted up already today, and for this gift to our community as we struggle to address the needs for homes for all who need those homes, and to ensure the supply, but also to make the connection directly to the people. Thank you for that work. I also want to mention that just yesterday, we received a word of an announcement from the United States Secretary of Commerce that the Greater MSP application for the National Build Back Better Challenge, now that's disconnected, of course, from the Build Back Better Act, but for the challenge, the $1 billion challenge, we had submitted this region, that is through Greater MSP, a phase 1 application. And only 11% of the 529 phase 1 applications that were submitted are going to phase 2. We received notification that we are one of that 11%. So we just need to celebrate that the work in this region is moving forward. Our phase 1 application, now moving to phase 2, is for an equity-focused bio-innovation corridor in the Twin Cities area. We have had Ramsey County staff involved and working in a number of collaborative efforts, I should say, to use federal funds, and in this one. And I want to say thank you to Carrie Collins and Deline Becker for their work and help to make phase 1 successful. And we know that they will be involved as well in the development of phase 2. So thank you so much for that work. I will also share that in Ramsey County, much is moving forward, as you know, on the transformation agenda, particularly in our justice arena, but across the board. In the justice arena, I should share with you that I was able to participate in a couple of things this past week that I think will be significant for us. One is the bail reform working group, and the bail reform work that is happening is out of, or I should say focused on, the justice arena with our county attorney, working together with our sheriff at the point of booking to reduce bail in Ramsey County. We're receiving support from national organizations in that regard. It was good to hear the update. The entire working group is meeting yet today, and we will be hearing about community engagement sessions that are being planned for next year in that area. There's a lot going on. Let me just also mention I had the opportunity to meet with a young group of people called Bridge Makers. This is an organization that is supporting connections and learning and even entrepreneurship for young people in Ramsey County. Again, congratulations to our staff for being able to seek out, find, and involve these kinds of connections in our community and to support young people as they work to support each other and advance their leadership in our county. We have a lot to do today, and there's a lot more to talk about. I won't write at this point in time because I think it is important that we move on, that we have a 10-minute break, but that we move on to our update, an important update, a closed update that the Ramsey County Board will have. There is a separate link, and board members are asked to join us on that separate link, closed to the public. We will meet 10 minutes after our adjournment at 11:10. We also have this afternoon at 1:30 a county board workshop that will be led by Commissioner McGuire. She talked about the fact that we are doing excellent work in our Ramsey County early childhood care and education arena. We'll hear about this afternoon at 1:30. There is a public Zoom webinar link on our website for all who would like to join us. With that, I'm going to suggest that we take that 10 minutes right now. We will move back into session on a separate link at 11:10. And at this point then, our board meeting is adjourned. Thank you.
Professional forestry staff have been executing a management plan that focuses on the removal and replacement of public ash trees. Our staff know as well as anyone the impact that losing trees has on individuals and neighborhoods across the city. But we have reached a critical phase in the infestation. Dead and declining infested ash trees quickly dry out and become brittle, are prone to failures such as dropping limbs, and pose an increasing public safety risk. By removing these trees from the landscape, we can then work to restore the urban forest by planting a more diverse combination of species where they once stood. The City of St. Paul has chosen not to embark on a long-term treatment program for public ash trees, but individual property owners can find more information